everyone, welcome to April's Medicare Minute. My name is Allison and I'm the SHIP Manager here at Baltimore County Department of Aging. This month, we're going to talk about Medigaps. Hopefully by the end of this presentation, you'll have a better understanding of what Medigaps are and how you can use them and what the costs are. So let's go ahead and dive in. So you might be wondering, what does Medicap cover? Well, original Medicare Part B covers 80% of the cost of most care. However, there's always that remaining 20% that beneficiaries are responsible for. So Medigaps are insurance programs that help to cover that 20% and sometimes can cover more. So what is a Medigap? Medigap is a supplemental health insurance sold by private companies. It works with original Medicare and it helps to pay for some of the remaining costs after Medicare pays first. What costs can Medigaps cover? Well, Medigaps policies may help cover deductibles, co-insurance, co-payments, often reducing or eliminating out-of-pocket costs for help or doctor visits. It's really important to know that not every Medigap plan is the same, and we're going to dive into that in the next slide. In the state of Maryland, you have 10 different Medigap policies that you can choose from. A, B, C, D, F, G, K, L, M, and M. It's a lot like alphabet soup. What's important to know is that each policy offers different set of standardized benefits, meaning that policies with the same letter offer the same benefits. The difference is that premiums vary based on company to company. So when you're looking at Medigaps and you're comparing the cost of them, if you're looking at a G plan from Blue Cross Blue Shield, it's the same G plan that is offered from Mutual of Omaha, but the prices may vary. You might be wondering why that is. A lot of times that can be because individual companies have more of a credible name, and so they like to increase their cost. So when you're looking at plans, make sure you're looking not only at the cost of them, but also check out the star ratings. You can do that at Medicare.gov. Those star ratings are an excellent tool to help show you what customers think of that company. Just because the company is well known and the Medigap costs a lot more doesn't mean that you're going to get the most excellent coverage. So it's really important to do your research to make sure that the Medigap that you're selecting is the best for you. Remember that Medigaps only work with original Medicare. If you have a Medicare Advantage plan, you cannot buy a Medigap. This is really important. It's actually illegal for brokers to sell you a Medigap plan if you have a Medicare Advantage plan. If you want a Medigap, you need to find the best time to buy one. Under federal law, you have the right to buy a Medigap if you're at least 65 years old and enrolled in Medicare Part B. It's really important to remember to be enrolled in Part B. So if you decide to delay enrollment in Part B because you are going to continue to receive employer benefits, and you are going to enroll in Part A but not Part B, it's not the time for you to enroll in a Medigap. Once you take on your Part B, that's the time to go ahead and enroll. There are two kinds of federally protected enrollment periods. The first is your Medigap open enrollment period. This is the 6-month period that begins the month that you are 65 or older and enrolled in a Medicare Part B. There's also importance to know about what a guaranteed issue right. And this really comes into play when it's the second time to enroll in your Part Medigap coverage. The second type of protected enrollment period is when you have a guaranteed issued right. You have that guaranteed issue right within 63 days of when you lose or end certain kinds of health coverage, like employee benefits. During these protected enrollment periods, insurance companies must sell you a policy. If you miss this time to buy a Medigap, your costs are going to go up and your options may be limited, or you may not be able to buy a Medigap at all because it's going to be based not only on your age, but on any health history that you may have. Even if you don't have the right to buy a Medigap in the state, you may still buy a policy if a company agrees to sell it to you. So you need to call and do some research and see if that's even an option. But know that they are definitely going to look not only at your age, but your health itself. Now, in the state of Maryland, there's another open enrollment kind of season when it comes to Medigap. This is known as the Maryland Birthday Rule. So this is a really awesome program that we do here in Maryland. It follows the 30 days after your birthday. You have the right to change your Medigap plan. You can switch to a whole other Medigap letter based off those 10 letters we just read, or you can switch companies within the same letter. What you need to know and what really matters most about this rule is that it allows you to shop for lower premiums or a different insurance company, and you can keep the same level of coverage while potentially saving money. You also need to consider that if you drop down for a plan that's lesser value, let's say, for example, I have a G plan, which covers a lot of Medicare costs. If I decide that it's not working for me, or maybe it's too expensive, and I want to drop down to a K plan, which is considered less value, then I am not going to be able to go back up to a G plan in the future. You can only change your plan to a less value or the same letter plan. So it's really important to remember that as you are trying to make your selection. When choosing a Medigap plan, you should think about your monthly budget, expenses, and healthcare needs when deciding if a Medigap is the right choice for you. Here are some questions to keep in mind when you are shopping. 1. Am I enrolled while I am in my open enrollment period? If not, do I have guaranteed issue right? 2. What is the Medigap's policy monthly premium? And how are premiums in my state set? 3. Does the policy have a waiting period before covering care related to pre-existing conditions? And 4. How do my cost and provider access with Medigap compare to Medicare Advantage plans in my state? These are all questions that you should be considering when you are choosing your Medigap plan, whether it's using the birthday rule or during your open enrollment season. All right, so that's kind of the explanation of Medigaps. We're going to go ahead and dive into just a little bit of fraud protection right now. We're going to talk about how you can keep yourself safe. And we're talking about medical identity theft. Medical identity theft can happen when someone steals or talks you into giving them your personal information, such as your name or your Medicare number. They can use this to bill unnecessary medical treatments or equipment to your insurances, like catheters, or maybe it's a service that you didn't receive. It's important to protect your Medicare number and only share it with trusted individuals. And you should report medical identity theft if you give out to a Medicare number over the phone or internet to someone offering a new Medicare card, durable medical equipment, genetic or dementia testing, cancer screening, or back braces, which is often what we see happen in the SHIP office. Individuals give out their Medicare card number because they are thinking that they're working with individuals that are secure, and they are not. Another thing you want to look out for is you are contracted, if you're contacted by a debt collector company for a provider bill that you don't owe, this might be a red flag that someone has stolen your identity and is using it to purchase and gain money from Medicare. You receive boxes of braces, testing kits, or other medical supplies in the mail that you didn't request. This is what we see most often, so it's really important that if you do receive that, you want to send that package back if you can, and if not, then you immediately want to call 1-800-MEDICARE to report that you received these packages so that they can look into that. And then the last one is if you were denied coverage services or for benefits that you should receive now because they said that you've received them previously. Another big red flag. You want to go ahead and alert Medicare that you had not yet received these benefits and that you are obviously a victim of suspected Medicare fraud. If you are experiencing any of this, please feel free to call our office at the SHIP Department at Baltimore County Department of Aging. We are here to support you and walk you through these types of experiences. Again, my name is Allison Dahl, and I'm the SHIP Manager of Baltimore County Department of Aging. If you have any Medicare questions or need support in any way, we are here to do that for you. Please give us a call at 410-887-2059. And feel free to email us at medicareinformation@baltimorecounty.md.gov. Thank you so much for joining us for April 2026 Medicare Minute. We'll see you next month.